Back now at Take Two on 89.3 KPCC. I'm A. Martinez. Doctors are learning more about a new Medi-Cal benefit that aims to reduce suffering for critically ill patients. Here to talk to us about the new health benefit and programs for all severely ill Californians is KPCC's Michelle Faust. Good to see you, Michelle.
Hi.
All right, so this new health benefit for Medi-Cal patients, so what is it?
We're starting at the beginning of this year. Medi-Cal managed care patients got a new required benefit, and that's palliative care. That's for 4 different conditions: people with congestive heart failure, advanced cancer, liver disease, or chronic obstructive pulmonary disease.
All right, palliative care, what is that?
Palliative care. A lot of people, when they hear palliative care, they equate it with hospice.
Right, that's what I was thinking. Yeah.
Right, but it's not the same thing. Hospice is more for end-of-life care. It's for people in the last 6 months of their life. You've stopped treatment and you're focusing on comfort care alone. Whereas palliative care continues treatment for whatever your underlying illness is. You could continue doing chemotherapy or other things. And the idea is this is easing the suffering of the severe illness, and there's a focus on quality of life. It goes further than just easing the suffering of your symptoms and the pain. Sonia Hernandez is the nurse that manages the palliative care program for LA Care, and she gave an example of a person with COPD or lung cancer.
Not being able to breathe has to be suffering, has to be uncomfortable. So palliative care is preventing that suffering or treating that suffering.
So think about the suffering. If you couldn't breathe, you're going to have some anxiety. Yep. So the palliative care takes care of the physical issues, the emotional distress that comes with it, and the spiritual problems.
How does a patient then receive palliative care?
Well, you've got a team of doctors, nurses, social workers, and chaplains to take care of that that spiritual aspect of things. If a person is alienated from their church community, for example, or some other community that gives them spiritual comfort, this is a way to kind of intervene and make sure the person has something else to take care of that. It finds whatever your needs are. Whoever can take care of your suffering, that's who is coming in. There are several settings where that can take place. It can be in a nursing home, in the hospital, but that also includes at home. Nurse Hernandez, again, says that the home care setting is preferable over a clinical setting often.
Right? You can't see what their home setup is like. You can't see how they take their medication. But when you're in their home, you get to see them in their environment. And then other needs are apparent, and then you can address them at that moment.
So think about finding those needs that a person might have, social services that they might need, take care of their depression, for example.
How new is this program? I mean, are all medical staff trained for this? Are they all up to speed on this?
Well, it's a somewhat new discipline, and it's been gaining momentum over the last few decades or so. The law passed for this new benefit 2014. It went into effect in 2018. The state has been ramping up in the meantime, and there's a new curriculum for doctors that's coming out. CSU San Marcos has got a curriculum to train doctors to learn more about it, and there are plenty of others. I was at a training this weekend, and I just got an email about a training coming up in April for UCLA.
So people are kind of trying to get up to speed as quickly as possible.
There you go.
Yeah. Now, we've discussed this kind of care for critically ill Medi-Cal patients. Is this kind of care available for other Californians?
In a word, yes.
Okay.
It's a Medicare benefit that's already existed for a while. Also, many private insurance companies have it. But what happens is, some doctors still aren't quite up to speed to know what it is. And so basically what people are saying is ask. If you believe that you're a candidate for palliative care, advocate for yourself, advocate for your family members, make sure your doctor knows what your treatment you need. Also, you may have other wants and needs that come up when you have a critical illness. And there are many conversations that you might want to have with your doctor, like an advance directive or what you expect at the end of your life.
Wow. It's funny, though, because you mentioned earlier how home care sometimes is best for this. I remember my grandpa, too. It was tough because with my grandpa, there was talk about him going to a hospital to get the care he needed at the end of his life. But we kind of made the decision to keep him at home. And I got a feeling, and I don't know, this is just me saying, I think we bought him more time.
Because
just being at home,
it can be the stress of being in the hospital. That can cause more complications. The other thing that happens is, when people are going into the doctor, going into the emergency room is not the ideal place to take care of everything. Also, you're exposed to microbes that you probably shouldn't be if you're an advanced illness. And so this also saves money in many cases. Distress, money, and it just overall, people who are advocates of palliative care see this as the best way to continue taking care of people in advanced stages of pretty severe illnesses.
If you have questions about this, Michelle Faust will answer them. You will answer, right? I'm speaking for you.
I will do my best.
You do your best. Okay, she's on Twitter at Miche Reports. That's at MICHE Reports. And we've been talking to KPCC healthcare reporter Michelle Faust about palliative care. And you can get more of her reporting on our website. That's Take Two. That's kpcc.org. Michelle, thanks a lot.
Thank you.